Welcome to RN Mujib, your trusted home for simplified and professional health education. If you're new here, hit the subscribe button and turn on the notification bell, so you never miss videos that can educate, empower, and potentially save lives. In today's video, we're focusing on a rare but serious bleeding disorder, hemophilia. Let's break it down in a clear and simple way. Hemophilia is a genetic bleeding disorder where the blood does not clot properly. People with hemophilia lack certain clotting factors, proteins that help stop bleeding. This means they bleed longer than normal, even after minor injuries, and they can also have internal bleeding, especially into joints and muscles. Hemophilia doesn't make your blood thinner, it simply makes your body unable to form stable blood clots. There are three main types of hemophilia. Hemophilia A, caused by a deficiency of clotting factor VIII. It is the most common type, affecting about 80% of hemophilia cases. Hemophilia B, caused by a deficiency of clotting factor IX, also known as Christmas disease. Hemophilia C, caused by a deficiency in factor XI. It is usually milder and more common in people of Ashkenazi Jewish descent. There's also acquired hemophilia, which is rare and develops later in life due to an autoimmune response, not inherited genetically. Hemophilia is usually inherited, meaning it is passed down from parents to children through the X chromosome. Since males have only one X chromosome, they are more likely to be affected. Females can be carriers and may experience mild symptoms. In acquired hemophilia, the body produces antibodies that attack clotting factors, usually due to autoimmune disease, pregnancy, or cancer. Key risk factors for hemophilia include family history, the biggest risk factor. Gender, males are more likely to have hemophilia. Ethnicity, some rare types are more common in certain groups, such as hemophilia C in Jewish populations. Autoimmune conditions, increases risk for acquired hemophilia. The symptoms of hemophilia depend on the severity of the condition, but may include prolonged bleeding from cuts or injuries, spontaneous bleeding into joints and muscles, swollen, painful joints, especially knees, elbows, and ankles, bruising easily, blood in urine or stool, frequent nosebleeds, after surgery or dental work, excessive bleeding. In severe cases, even minor trauma can cause life-threatening internal bleeding, including in the brain. Hemophilia is diagnosed using blood tests that measure clotting factor levels, bleeding time, partial thromboplastin time and prothrombin time. Genetic testing can confirm the type and help identify carriers in families. In newborns, if there's a family history, doctors usually test immediately after birth. While there's no permanent cure for hemophilia, it can be managed effectively with proper care. Replacement therapy, infusing the missing clotting factor VIII or IX through the veins. Desmopressin, a medication used for mild hemophilia A that boosts the body's release of stored factor VIII. Gene therapy, a promising new approach that aims to fix the faulty gene, potentially offering long-term control. Antifibrinolytic drugs help prevent clots from breaking down too quickly. Physical therapy for joint protection and recovery. People with hemophilia often carry emergency ID bracelets and must avoid trauma, high-contact sports, and certain medications like aspirin. While you can't prevent inherited hemophilia, you can manage it effectively and reduce complications with these tips. Learn to recognize early signs of bleeding. Administer clotting factor replacement at home if needed. Stay physically active. Low-impact exercises like swimming are great. Avoid injuries and falls. Get routine dental care to prevent procedures that cause bleeding. See a hematologist regularly for monitoring and advice. Educate your family, school, or workplace on what to do in case of bleeding. For women who are carriers, genetic counseling during pregnancy is recommended. Hemophilia may be rare, But with early diagnosis, proper treatment, and education, people with hemophilia can lead active and fulfilling lives.